Have you ever heard or wondered, how does the prostate change for men after the age of 60? This is a question that many of us think about, but not everyone feels comfortable discussing or looking deeper into. The prostate is an important part of the male body, but most of us only pay attention to it when there are issues. When unusual signs start appearing in the body, we may feel worried, confused, and sometimes anxious. At the age of 60 and beyond, hormonal changes and natural aging processes strongly impact sexual function and prostate health. This is unavoidable, but fortunately, there are measures that can help you maintain the best prostate health possible. In this video, I will share important information about the changes in the prostate and how you can protect your health if you are over 60 years old. Make sure to watch the whole video. It could change the way you take care of your health every day. And don't forget to leave a comment about your age and country under this video. I am looking forward to hearing from you. The prostate is a small organ, roughly the size of a walnut, located just below the bladder and surrounding the urethra, the tube that carries urine from the bladder out of the body. Despite its small size, the prostate plays a crucial role in male sexual health. The main function of the prostate is to produce fluid that nourishes and protects sperm, helping sperm move and survive in a favorable environment for fertilization. Therefore, the prostate plays an essential role in the male reproductive system and sexual health. When you are young, the prostate functions efficiently without showing any abnormal signs. However, as we enter middle age, and especially after 60, the prostate may begin to undergo certain changes. This is the stage when many men start to notice changes in their urinary and sexual function. One of the most common issues in men over 60 is prostate enlargement, also known as benign prostatic hyperplasia. This is a natural phenomenon that most men will experience as they age, although not everyone will go through this condition. An enlarged prostate can lead to problems such as frequent nighttime urination, difficulty urinating, or the sensation of not being able to fully empty the bladder, even after trying. These changes often occur gradually, and symptoms may not always be immediately noticeable. However, when these symptoms do appear, they can be quite bothersome in daily life. This can also affect the quality of sleep and comfort in daily activities. In addition to enlargement, the prostate may also be affected by hormonal changes, especially testosterone. As men age, testosterone gradually declines with age, and this imbalance in hormones can cause the prostate to become more easily stimulated and grow uncontrollably. To better understand these changes and how to protect and maintain prostate health, it is important to look into preventative measures and healthy habits. Paying attention to the early signs of prostate changes and having a proper healthcare plan will help you maintain a better quality of life. As we enter middle age, our bodies no longer maintain the same flexibility and energy as they did when we were younger. Along with this, one of the major changes that many men face is the change in the prostate. This is a small gland, but it plays a crucial role in male sexual health. The prostate is located just below the bladder and surrounds the urethra, the tube that carries urine from the bladder out of the body. As part of the reproductive system, the prostate produces fluid that nourishes and transports sperm. However, when men reach the age of 40 and beyond, the prostate begins to change, especially after 60. This is part of the natural aging process, but it can also lead to concerning health issues. One of the most common changes that most men experience is prostate enlargement, also known as benign prostatic hyperplasia. While this is not a cancerous condition, excessive growth of the prostate can affect the urinary system's function. As the prostate enlarges, it presses against the urethra, restricting urine flow which leads to problems such as difficulty urinating, frequent nighttime urination, or a feeling of incomplete emptying of the bladder. These issues can develop gradually and sometimes may not immediately attract attention. However, when these symptoms persist, they can cause significant disruptions in daily life and impact the quality of sleep. One of the common problems men face with an enlarged prostate is nighttime urination. This condition requires waking up several times during the night to urinate, disrupting sleep and leaving the individual feeling tired and sluggish the next morning. If this condition continues, it can affect overall health and decrease the quality of life. Additionally, when the prostate enlarges, some people may experience a sensation of incomplete urination, even after going to the bathroom, feeling as though the bladder hasn't been fully emptied. This is also a warning sign that we need to pay attention to. However, benign prostate enlargement is not the only cause of these changes. Another important factor is the change in hormones as we age. Testosterone levels, the key hormone controlling many functions in the male body, begin to decrease. Along with the reduction of testosterone, the body starts converting testosterone into dihydrotestosterone. This is a more potent form of hormone that directly impacts the prostate. The accumulation of DHT in the prostate can stimulate the uncontrolled growth of prostate cells, leading to enlargement when testosterone decreases. DHT becomes the primary factor stimulating prostate growth, causing prostate enlargement. This explains why, as men age, the prostate tends to grow more. However, not only hormonal changes, but also other factors such as genetics and lifestyle habits can affect the prostate. Maintaining a healthy diet, regular exercise, and routine health checkups can help reduce the negative impacts of aging on the prostate. Furthermore, the decline in prostate function can lead to other health issues, such as prostatitis. Prostatitis can cause pain and discomfort in the body, affecting sexual function and urinary health. However, not everyone realizes that prostate issues can impact other aspects of life, including male sexuality and comfort in daily activities. Along with prostate enlargement and hormonal changes, the risk of developing prostate cancer also increases with age. Therefore, routine health checkups and maintaining a healthy lifestyle are crucial for early detection of abnormal signs and proper treatment. Thus, prostate changes are a natural and unavoidable part of the aging process. However, these issues can be controlled and prevented if we understand these changes and take appropriate healthcare measures. Maintaining a healthy lifestyle, eating a balanced diet, exercising regularly, and getting regular health checkups will help you live a healthy life and minimize prostate-related issues. One of the common questions many men ask themselves is whether the habit of masturbation affects the prostate, especially as they enter middle age and older age. This is a sensitive topic that not everyone feels comfortable discussing. But understanding the impact of masturbation on prostate health is very important. According to scientific research, there is a connection between the frequency of masturbation and prostate health, particularly as men reach their 40s, 50s, and 60s. One notable study published in the journal European Urology followed a group of men over nearly 2 decades. The results of this study showed that men who masturbated frequently, particularly around 21 times or more per month, had a lower risk of prostate cancer compared to those who masturbated less often, around 4 to 7 times per month. This is an important finding as it shows that masturbation can offer some benefits for prostate health, although it is certainly not the only method to protect the prostate. One theory explaining this relationship is the prostate flushing hypothesis. According to this theory, Each time a man masturbates or ejaculates, it may help flush or cleanse the prostate, removing old cells and toxins that accumulate in the prostate. This helps minimize the risk of infection and enhances the prostate's ability to fight abnormal cells, thus reducing the risk of prostate cancer. Cleansing the prostate in this way is similar to bodily hygiene that removes harmful waste materials. However, it is important to remember that masturbation is not a miracle cure that can fully protect the prostate from health issues. Maintaining a healthy lifestyle, eating properly, and engaging in other good habits, such as regular exercise, routine health checkups, and maintaining a healthy weight, are also key factors in protecting prostate health. Moreover, excessive masturbation can lead to certain mental and physical health issues. Masturbating too frequently can result in feelings of fatigue, stress, or even psychological disorders. Therefore, everything should be done in moderation and balance. One important factor to note is that masturbation can have certain effects on the urinary system if masturbation is not controlled. It can sometimes lead to problems such as nighttime urination or difficulty urinating. This is especially true when the prostate has already begun to undergo age-related changes. When the prostate enlarges, excessive masturbation may put additional stress on the prostate and exacerbate symptoms like incomplete urination, difficulty urinating, and other urinary issues. Additionally, as men age, hormonal changes in the body also affect the function of the prostate. Testosterone, the key hormone for male sexual health, gradually decreases with age. As testosterone declines, the body begins to convert testosterone into dihydrotestosterone. DHT can cause abnormal growth of prostate cells, leading to prostate enlargement. Therefore, while masturbation may help cleanse the prostate to some extent, it cannot replace maintaining a healthy lifestyle and comprehensive healthcare practices. So, is masturbation the only way to protect the prostate? The answer is no. While this habit may offer some specific benefits, it is only one part of a larger picture when it comes to prostate healthcare. Combining a healthy diet, regular physical activity, stress reduction, and routine health checkups will help maintain long-term prostate health. Therefore, it is important for every man to recognize the significance of protecting prostate health and find a balanced way of living. Do not rely on a single factor, but instead develop a comprehensive healthcare plan to protect the prostate and maintain quality of life throughout life. Prostate health is influenced by many different factors, not just aging. One of the most important factors is diet. An unhealthy diet, especially foods high in saturated fats, sugars, and processed foods, can contribute to an increased risk of prostate issues such as prostate enlargement. Foods rich in antioxidants, particularly lycopene found in tomatoes and red-colored fruits and vegetables, can help protect the prostate and reduce the risk of prostate cancer. Additionally, foods containing omega-3, such as salmon, chia seeds, and walnuts, are also beneficial for the prostate because they help reduce inflammation and improve overall health. In addition to diet, physical activity is another essential factor. Maintaining a regular exercise routine not only helps reduce stress, but also improves blood circulation, which supports prostate health. Exercises that help control weight and maintain heart health can also reduce the risk of prostate conditions. One recommended exercise is Kegel exercises, which strengthen the pelvic floor muscles and improve urinary control. Performing these exercises daily can help reduce nighttime urination, difficulty urinating, and support long-term prostate health. Stress and psychological tension also have a significant impact on prostate health. When the body faces prolonged stress, levels of cortisol and adrenaline hormones rise, which disrupts the balance of other important hormones, including testosterone and dihydrotestosterone. This imbalance can increase the risk of prostate issues. Therefore, finding ways to reduce stress, practicing relaxation techniques such as meditation, yoga, or simply maintaining a calm mindset is also very important. Finally, regular health checkups are essential. Regular checkups help detect potential prostate problems early, before they become serious. Tests such as prostate-specific antigen can assess the health of the prostate and detect early signs of prostate cancer. Therefore, routine health checkups are a critical step in protecting prostate health and maintaining overall well-being. In conclusion, prostate health is influenced by many factors, including diet, physical activity, stress management, and regular health checkups. A healthy lifestyle, combined with proper preventive measures, will help you protect the prostate and maintain long-term health. Prostate healthcare is not just about detecting and treating symptoms when problems arise. It is a proactive preventive process from the start. To protect the prostate, there are some simple but effective measures you can take every day. These measures not only help maintain prostate health, but also contribute to improving the quality of life, especially for men over 60 years old. First and foremost, a healthy diet is the most important factor in protecting the prostate. A diet rich in fiber, vitamin C, vitamin E, and lycopene will help protect the prostate from negative effects. Lycopene, a powerful antioxidant, can be found in foods such as tomatoes, red peppers, and watermelon. Omega-3 rich foods such as salmon, chia seeds, and walnuts also have anti-inflammatory effects, helping to reduce the risk of prostate enlargement and related issues. Additionally, limiting the consumption of foods high in saturated fats, sugars, and processed foods will help reduce the risk of prostate diseases. Along with diet, physical activity is an essential factor. Regular exercise helps maintain ideal weight, improves blood circulation, and supports prostate health. Gentle exercises like walking, cycling, or swimming can help you maintain overall health. One particularly useful exercise is Kegel exercises, which strengthen the pelvic floor muscles, assist in regulating urinary function, and help protect the prostate. This exercise is simple and can be done anywhere from home to the workplace. Stress reduction is also an important factor in protecting prostate health. Chronic stress can affect the hormones in the body, particularly the balance between testosterone and dihydrotestosterone, a factor related to prostate development. Practicing relaxation techniques such as meditation, yoga, or simply spending time on personal hobbies will help reduce stress levels and maintain hormone balance in the body. In addition to maintaining a healthy diet and lifestyle, routine health checkups are indispensable. Men aged 50 and older should undergo tests like prostate-specific antigen to monitor prostate health and detect early signs of abnormalities. Regular checkups help identify prostate-related conditions in time, from benign prostate enlargement to prostate cancer, allowing for effective treatment at an early stage. Finally, maintaining a balanced lifestyle and creating good habits every day will help protect your prostate throughout your life. Although aging may bring about health changes, proactively caring for your body through simple measures will help minimize prostate-related issues and maintain long-term quality of life. The prostate is an important part of the male body, and taking care of prostate health becomes even more crucial as we enter middle age and beyond. The prostate can change over time, especially as we age, but these changes are not uncontrollable. If we take a proactive approach to our health care, Protecting the prostate and maintaining quality of life will become easier. Prostate issues, such as benign prostate enlargement or prostatitis, can arise when we neglect factors such as diet, physical activity, and stress levels in our lives. However, you can minimize these issues by maintaining a healthy lifestyle. A diet rich in antioxidants and healthy foods like tomatoes, pistachios, and walnuts will help protect the prostate. Additionally, maintaining a regular exercise routine is extremely important. Exercises like Kegel, walking, or swimming can strengthen prostate health, reduce symptoms of nighttime urination, and improve overall quality of life. Moreover, routine health checkups help detect early signs of abnormalities and allow for timely treatment. Don't wait until problems arise to start caring about your health. By taking care of your prostate health today, you can maintain long-term wellness and enjoy a fuller life. If this video has been helpful, don't forget to subscribe to the channel for more videos on senior healthcare.